You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with gum disease. The symptoms include bleeding gums, bad breath, loose teeth. If you have any of those symptoms, you have to hear the message on today's program. We put together a documentary where we actually go inside and look at this new laser that is literally killing the bacterial infection in the mouth on contact. And with us we have Dr. Thrasher. Dr. Thrasher, welcome to the program.
Randy, it's a pleasure to be here.
So Dr. Thrasher, for people that don't know you or your practice, tell me a little bit about your practice. Who's your typical patient and what are the different services that you offer?
Randy, it's a general dentistry practice. It's family and cosmetic dentistry. We do all the procedures you do in general dentistry. You know, we do whitening, fillings, crown, bridge, veneers, cosmetic dentistry, full mouth makeovers, comprehensive general dentistry, along with treating gum infection, dental implants, dentures, overdentures, you name it in general dentistry, and we do it here.
Now you serve a big community, I guess not just in Waco, but people travel great distances to see you.
Sure, they travel from, I would say, 60 to 100 mile radius around Waco to come into our practice for these procedures, especially I might mention sedation dentistry, which I've been doing for over 20 years.
Now your practice is unique. I've seen the photos. I guess you used to be inside of either a steakhouse or some sort of a restaurant?
Yeah, I mean, this was a restaurant. It was a barbecue restaurant, and I converted it into a dental office, just a beautiful dental office. I'm very proud of it because it looks like a lodge. I mean, it's got a neat, warm, home kind of feeling, big vaulted ceilings, and the patients love it. It's just a neat place to come to work every day.
So jumping right into gum disease, what are the symptoms?
Okay, so Randy, here are the symptoms. Red, puffy, swollen gums, loose teeth, a bad taste or a bad odor in your mouth. Those are the key ones. Those are the ones that somebody might notice. But then there are symptoms that patients don't even know. I mean, a lot of patients don't even know they have gum disease.
But isn't it a little normal to have a little blood when you floss?
No, not at all. I mean, if your gums bleed, you have infection. You know, healthy gums do not bleed. I tell patients all the time, you can floss as aggressively as you want. You can, a lot of people use toothpicks. Not necessarily the right thing to do, but if your gums are healthy, you cannot make them bleed.
So gum disease, periodontal disease, are they the same thing? And how big of a problem is it? I mean, a lot of people have it.
It's the same thing. A lot of people have it. It's a bacterial infection of the gums. It has inflammation, which is why we have bleeding and red, puffy, swollen gums. 80% of the population has some form of gum disease. And so it's very prevalent in our population. And of those 80%, a very high percentage, maybe 1 out of 3, have the more serious form that involves bone loss around the roots of the teeth.
So you are using this FDA-approved laser in Waco. Anybody else doing it, using a laser in Waco?
No. A lot of people are not using the laser in Waco. This is relatively new, probably been around for, I'd say, 8 to 10 years. I've been using it for 6 years. It's an amazing tool, and I've been practicing 36 years now, and I've treated a lot of gum infection in those 36 years. And in the last 6 years, being able to use this laser, man, it's been incredible what we've been able to do for patients with this laser.
So after you go around the mouth with the laser, these symptoms go away?
Once you've treated the gum infection with the laser, the bleeding stops, the healing begins, and the tissue actually tightens up and reattaches to the tooth. And so the patient no longer has the swollen red puffy gums, or the bad taste, or the bad odor. All those signs and symptoms that they had before are now gone.
Dr. Thrasher, we're going to take a quick break. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
I'm the clinic administrator for Dr. Thrasher. I've been with him for 9 years. I've met so many patients over the years. I know their names by heart, their children's names. I've seen so many transformations over the years. It is absolutely amazing. There were patients that I've met that were so afraid of the dentist that now are not afraid to come see us. There were patients that would not smile. Now they smile all the time. Their family and friends tell them how much they smile. They have just transformed themselves. They have this persona, this glow about them that is amazing, and it's so rewarding to be a part of that.
I had the laser surgery done on my gums. It was an amazing experience. It didn't hurt. The sedation was wonderful. I'm able to eat what I want to eat. My gums aren't swollen, no bleeding. It was a great procedure.
My role at Dr. Thrasher's is actually as one of his hygienists, and this is my room. I see patients all the time that have had the laser procedure, the LANAP done, and it's amazing. I used to have patients that would have to come in yearly for either root debridement therapies or cleanings, and once they've had the LANAP surgery done, they're actually coming back to me with healthy gums, little to no bleeding, so it's really remarkable. These are actually even patients that before, their only option was to have seen a periodontist, and in a lot of cases they would have done traditional cut and sew gum surgery that can leave them little dark triangles between their teeth, and of course nobody likes to see that. It can even give the illusion of having longer teeth, sometimes with tissue is cut away, so the LANAP actually helps people to preserve their beautiful smile, have healthy gums with little to no bleeding. It's pretty amazing.
I had the laser surgery done 8 days ago, and today I feel better than I have felt in years. My teeth feel stronger. I was told several years ago that I was going to have the surgery where they cut the gums and they stitch you up, and a friend of mine had that probably 7 or 8 years ago, and I was like, there's no way they're cutting into my gums, they're gonna stitch me up. But I came in for my dental cleaning a few weeks ago, and they told me about the laser surgery, and it sounded very promising. And as it turned out for me, it worked out really good, because I mean, there was very little pain involved with it. I had a very bad experience with a dentist several years ago, and I had very high anxiety coming to any dentist. And I started coming to Dr. Thrasher probably 3 years ago, and since I've been coming here, I have no more anxiety. I feel good about coming to the dentist. I look forward to it.
I actually have patients that, again, they would have these deep areas underneath the gums, so a lot of bacteria, a lot of toxins that we get trapped in, and I would have to see them regularly for us to get underneath the gums, scrape out all the bacteria to try to get them healthy again, but because the area was so deep, we would have to do this over and over and over again. So now with the laser, I'm actually able to let Dr. Thrasher use the laser LANAP around them, and what it does is he can go underneath the gums, remove all that buildup, and then sterilize the area underneath the gums and seal it off from bacteria re-entering.
Fearful patients, patients that have been told they were going to lose their teeth, patients that fear having to wear a denture, something that they may not can wear, that they cannot emotionally, psychologically, physically tolerate.
Before, I would brush my teeth, I would have bleeding, hurting, coldness sensation was bad, but now that I've had this done, it works wonderful. Everything's great. Oh, my gums are great. I can brush my teeth, no bleeding, no cold, no sensation to cold. It's a great experience. I can eat corn on the cob, I can eat a sandwich without having to worry about any pain or discomfort whatsoever. It's been really good.
As a hygienist, I actually get to see the patients after they've had the laser done, come back when they're smiling and when they're happy. These are patients who initially came in worried about losing their teeth, and now they're talking about, I'm ready to do veneers, I'm ready for a beautiful smile, I'm ready to show people, a new face.
If people have bad breath, loose teeth, bleeding gums, we invite them in. Call and make an appointment. We want to help them get healthy.
You're watching The Wellness Hour. I'm Randy Alvarez. We are talking about gum disease today, new treatment options for people that want to avoid surgery. The symptoms include loose teeth, bad breath, bleeding gums, and Dr. Thrasher says he treats it as a bacterial infection, which is what it is. And with his laser, he goes around the mouth and targets that infection and kills it on contact. So we'll start with our first question. So I guess there are two ways to get rid of gum disease, and you do it differently. Tell me about that.
Okay. I've actually done it both ways in my career, but how we do it now with the laser is by using the laser to actually remove the bacteria and kill the bacteria in the pocket or in the gum pocket or in the gums, and then let that tissue heal by reattaching to the smooth root surface in the bone, so that whole gum tissue, root surface, bone structure tightens back up and becomes healthy again.
So it's a bacterial infection?
It's a bacterial infection, and we use the laser to kill the bacteria. There's one thing that's very important that I like to tell patients. It's a simple little equation. Bacteria plus sweets. So people that eat or drink a lot of sweets, you put those two together and it produces acid. This acid in contact with the gums and with the bone is what causes the damage, whether it be cavities or in this case, the gum infection. So what do we have to do? We have to remove the infected tissue. We do that with the laser. Now, you also ask about the old way that it's done and still being done today.
So they normally do it with surgery?
They normally do it with surgery, and that's obviously where you would cut the tissue away and remove gum tissue and use stitches or sutures to suture the tissue back together so it can heal, which is obviously a much more invasive, aggressive procedure that we no longer have to
But
use.
it is effective.
It is effective, but it has a lot of side effects, in my opinion. You know, patients complain of the way it looks. It can leave big gaps between your teeth because you're cutting away a lot of good gum tissue at the same time that you're cutting away the bad gum tissue. With the laser, we only get the bad gum tissue. And then secondly, you expose the roots of the teeth. Patients do not like this because it is very sensitive. You know, can't eat ice cream, real cold water, iced tea, super sensitive. So that's some of the side effects or downsides, if you will, to the old surgical technique.
You know, when we were looking into this on your website, you have these little buttons that say no cut, no sew. What does that mean to you?
Again, that relates because we're trying to get the word out to the patients that we no longer have to surgically cut the gums away and suture or stitch the gums back together. With the laser, you don't have to do that.
So you were skeptical before you got the laser.
I was skeptical at first. It actually took me about almost 3 years of really following this research and going to courses and getting the good feedback that I needed to get to feel confident that this was the right thing to do. And it's now, in my opinion, should be the standard of care for treating gum infection.
So Dr. Thrasher, you know, anticipating this interview, I've talked to other doctors. In fact, one well-known periodontist, Dr. Stephen Brown, who is a periodontist who teaches on this subject. And he says he used to do the surgical procedure, and he says he would never do it any other way for periodontal pocketing using the laser now.
Yes, I still think there are a lot of skeptics out there about this technique, but it's proven. It's an FDA approved. I've gotten the results, so I know it works, and I see it every day in my practice on my patients. So I'm excited about it.
So what do they say? I mean, when it's all done, what do they tell you?
Oh yeah, I've got this one lady, and let me tell you the story about this one lady. She came in, and she had already been told she was going to have to lose all of her teeth. She was going to have dentures, and she was devastated by this. So she came in and to find out about the laser, and we followed through, and she accepted, and we did the treatment. We saved her teeth, and she is happy. She appreciates what we've done for her. She feels like every penny she spent, in other words, she values the treatment and she appreciates what we've done for her. And now she's referring and sending other patients to us because of what we were able to do. Otherwise, she'd be in dentures right now. We're changing people's lives every day because, number one, we're helping them save their natural teeth. They can eat things that they would not normally be able to eat if they had loose teeth or they had dentures or they lost their teeth. So it is changing people's lives. To have your own natural teeth and your own natural smile, that's super important to people, and that's what they're looking for. And if they know they can do it with a technique that's more comfortable, less pain, less bleeding, less swelling, less time away from work, all of those factors play into this, and it's just for patients, it's a dream come true. And when you help them save their natural teeth, they can go to any restaurant for that matter. They can go to our favorite steakhouse. Maybe it's the Outback Steakhouse or someplace like that. and order anything on the menu and eat a steak that they normally wouldn't be able to eat with, say, dentures if they lost their teeth, or corn on the cob, or bite into an apple. You know, these are things that are taken for granted, and now they can have their teeth for a lifetime.
We're going to take a quick break, and we'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
The laser has changed everything. People that feared that they were going to lose their teeth, we are now saving their teeth, and they are just so happy. People that were scheduled for conventional gum surgery, they're not having to do that anymore. It is amazing. The technology of the laser has just changed their lives, and it is just amazing.
I haven't liked my smile since I was a kid, probably elementary school. I felt that my teeth were too big, and so when I smiled, I either smiled with my mouth closed or I covered my mouth. I didn't laugh a lot, again, always trying to hide it. So I should have done this a long time ago. I'm glad I did it now, though.
During the procedure, I was sedated. I didn't feel anything. I was at ease. I didn't worry about anything. I knew I was being taken care of. And I feel great. My teeth feel, again, they feel stronger. The tissue around my teeth is stronger. It was a very good experience, and I would recommend anybody to do it. I'd highly recommend it.
When I'm outside the office, it comes up all the time. People who have said, hey, I have a dentist who's told me that I need to have gum surgery done. What do you think of this? And honestly, I can tell them case after case, person after person, of how remarkable and what amazing results that we're getting. I've had people who have had almost going to lose some of their teeth, being able to save them with the laser. I have one lady, beautiful, beautiful smile. The majority of her mouth is healthy, but she had 3 teeth on the front that if not treated soon, she was going to lose. And after the laser procedure, she was able to save her teeth, save her smile, again, with very little discomfort. This was an amazing thing for her. I mean, losing your front teeth is devastating, and the laser can prevent that.
We see so many patients that were so fearful. They have such a phobia of going to the dentist. Maybe it was because of a bad childhood experience, or maybe it was even a bad adult experience, and they're afraid to even make an appointment, pick up the phone, to walk through the front door. And the communication that Dr. Thrasher and the entire team that we have here is so well developed that the patient overcomes that fear, and we gain the trust and the confidence in that patient, so that they do build that confidence level up, so that they have the opportunity to get healthy. We can create that beautiful smile for our patients, and so that they have healthy teeth and healthy gums and have this beautiful smile in the end.
I don't think I'd ever said this before, but I actually like coming to the dentist. I have no pain or discomfort anymore. So it's a pleasant experience, as before it was a horrifying experience. And now I don't have that problem anymore.
We see it every single week. People who were scheduled for gum surgery and probably scared to death of it, because most people aren't excited about getting their gums cut on, sewed, come to our office excited about the laser procedure, excited to try something with little to no soreness afterwards, be able to go to work the next day and have healthy pink gums again.
I think that my self-confidence has definitely come up a lot, and so I am more approachable. And people come up to me and say that they think they know me, and so I just feel very happy with myself, and I think that is shown to everybody out there. People that I've come across now, I let them know that there's Dr. Thrasher's office. You don't have to be afraid to go to the dentist. I was always afraid. I had a hard time getting numb and staying numb. But sedation dentistry changed all that for me. Even coming in for a teeth cleaning, they put the lappy gas on and just helps you relax. And this is the only dentist I've ever been to that gives you that option. So I'm not scared anymore. it doesn't hurt anymore, and anybody can do it.
I have gotten a lot of compliments since I had my teeth done and my laser procedure done. And it's pleasant, because before I'd be a little shy, wouldn't smile so much, but now it just kind of boosts your little, makes you feel better.
I had bleeding gums when I would come in for my cleanings before, and now my gums don't bleed. I mean, I can even brush my teeth now and my teeth are not bleeding, my gums are not bleeding. And they're very strong now. The tissue around my gums and the teeth themselves. You know, before I could push my tongue up against them and they would move and they would, you know, wiggle a little bit. And now they're strong and I feel like I can eat meat again.
You're watching The Wellness Hour. I'm Randy Alvarez. We are talking about gum disease today, new treatment options for people that want to avoid surgery. The symptoms include loose teeth, bad breath, bleeding gums, and Dr. Thrasher says he treats it as a bacterial infection, which is what it is. And with his laser, he goes around the mouth and targets that infection and kills it on contact. So we'll start with our first question. You say your hygiene department has changed. How so?
Absolutely. I mean, they're so excited when patients come back in that have had this treatment and their gum tissue is reattached. Those pockets are eliminated and gone, and they're not packing food down in between their teeth. It makes the patients happier because their cleaning is a lot easier, and the hygienists are happy because they're not having to do all this scraping on their teeth that the patients don't like anyway. So it's a win-win. Patients win, the hygiene department wins, and it's just a win-win.
So the part I don't really understand is if they were told they needed an extraction, that means the tooth had to come out, how are you able to save the tooth with the laser?
Well, it happens over and over, and we see this all the time. Patient thinks that they're going to lose the tooth, and we see that we can save the tooth with the laser because we can treat the gum infection and get the gums to begin to reattach to the tooth, which is getting loose. The bone, which is trying to regress or move away from the tooth, that becomes healthy and it starts to regenerate. So we're regenerating bone. We're getting this tissue to really shrink back around and tighten up on that tooth, which causes that tooth that used to be loose to be not loose or stable, solid. And that's what allows patients to be able to save the teeth that otherwise would, I'd say in most dental practices, it'd be very common for them to go in and they just say, we got to take this tooth out.
Is there any science behind this?
There's solid science behind this. In other words, it is the only FDA approved, science-backed and based laser surgical gum treatment out there. And of course that, after my research of 2 or 3 years, and I found that out, and I saw it proven in my own practice and in other practices. I mean, that's why I use that technique now.
You know, I spoke to your office manager on the telephone, and she said that you have patients that surgeries were scheduled elsewhere, and those surgeries, in certain cases, were canceled, and you were able to take care of it with your laser, going around the mouth.
Absolutely, and again, it's because they found out that there was another way to treat it with the laser. And so they wanted to find out information about the laser and what's the difference between the old way and the new way. And once they heard the advantages of how we do it with the laser, it was just obvious that they would want to do it that way. You know, again, less pain, less swelling, less bleeding, less time away from work, less sensitivity after the procedure, no sutures and stitches to go back and take out. You know, once they saw the contrasting difference in one way to treat the problem and another way to treat the problem, it was a no-brainer.
Now, one of the things that you said, Randy, I want to take you on a tour of my office because I guess it used to be a barbecue restaurant. So what are we going to see in this video?
Well, we're going to take a walk through and we're going to see how I took this restaurant and completely gutted it and turned it into like a one-of-a-kind dental practice that the patients love. And the main reason they love it because it does not look like your typical dental medical office. I mean, it looks like a lodge. It's very comfortable. It has a fireplace in the reception area. The people love to sit there. They can watch TV if they want to watch TV. It has a nice water feature, so there's a nice comforting sound.
Okay, let's take a look at the video.
Okay. Hi, I'm Dr. Michael Thrasher, and welcome to Hillcrest Dental Care. I'm going to give you an inside look at my practice, my building, and a little inside look into laser dentistry. Okay, and there's Catherine. She's visiting with the patient, having a good time. And these are our operatories along this side where we do most of our hygiene. Most of our hygienists do their work. Yeah, we're a family general dentistry practice, and we do everything under one roof here. We do dental implants in-house, we do fillings, we do veneers, we do obviously perio laser dentistry here, pediatric dentistry, IV and oral sedation. And so on this side we have another 5 operatories, and actually this is the side where I spend most of my time. These are my surgical ops where we do our laser dentistry, our comprehensive dentistry, as well as just all the things we do in general dentistry: extractions, partials, dentures, crowns, veneers, cosmetic dentistry, full smile makeovers, implants, you name it. Probably these 3 operatories right here are all set up for doing anything you can do in dentistry in-house.
Okay, so take me through the process. Somebody goes to you, they have symptoms. What can they expect on day 1?
Okay, well, we get the patient in, we meet the patient, we find out what their concern is, we do an exam, we find that they do in fact have the gum infection problem that needs to be treated. We answer their questions, we get them scheduled, we treat them, and it's that simple.
It's good stuff. Now, we are out of time. So somebody watching this, and they have the symptoms that you've talked about: bleeding gums, bad breath, loose teeth. What's your final message to them?
Give us a call. Let's get you in. Let's take a look. Let's find out what we need to do to get you healthy, and let's get those gums healthy.
So most of these people are getting IV sedation. I mean, you're known for IV sedation, you say, in your town.
Absolutely. I mean, we have a lot of patients. I would say I see 3 to 4 patients every day that are sedation patients. They want to be comfortable. They want to be able to get in and get out and get as much done. That's probably the number one thing, Randy. They want to get as much of their dental care done. We've been talking here about treating their gum problems with the laser, doing the LANAP procedure. What's more beautiful even than that is when we have patients and we're treating their gums and a broken tooth and a tooth that's abscessed and needs a root canal. All these things, it might take 8 or 9 or 10 visits in 2. And so when they can see that they can get a lot of dental work done, they're not going to have to miss work, they're not going to be in pain, they can't believe it.
I want to thank you for coming on the show, and I love your enthusiasm. I mean, you really love this.
I love it. This was a real pleasure to be able to visit with you and explain some of the treatment with the laser and how we help patients and how excited they are. And it's just, like I said, it's just a win-win for everybody.
So is your goal to wipe out gum disease in Waco?
Absolutely, wipe out gum disease, save teeth, create smiles, make happy, satisfied patients who refer other patients to us so we can get to them and help them save their teeth.
Very good. Thank you very much, by the way. Dr. Thrasher, thanks for coming on the show. We're out of time. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. I wish you good health.